hair loss is not fun. It's complex, it's complicated. And so what can we do for you, the medically induced hair loss individual that knows what's to come? Well, I can tell you, we can be proactive and we can start treating your scalp and we can start treating the hair. Hi, everyone. Thank you so much for coming back to join us today for another edition of Restoring Your Roots and Your Confidence. So today we're really going to dive into something a little personal, and we're talking about acute alopecia, and that is hair loss that has been caused, if you will, by medical-related treatments, such as the one we most know and are most familiar with, cancer treatments and radiation therapy treatments. So it's a challenge, right? You've been given a diagnosis. You have to go through treatment. And sometimes maybe you're early stage, right, in your development of your cancer, cysts, or tumors. And so you know the outcome is very positive. However, what really throws a wrench into your life is when your oncologist or your surgeon talks about your chemotherapy or your radiation therapy, and then you know automatically the side effects can cause hair loss. So we know that it's troublesome, and we know that it is very, very concerning. But I also want to tell you that I have been involved in this line of specialty and helping chemotherapy and radiation therapy treatments for over 20 years. And so what we have finally realized is that if we could help you on your journey much earlier on, right? Instead of being reactive, let's be proactive. So HPI created a Be Proactive therapy and treatment plan just for you. So what we have done is we really wanted to take a moment and think about and understand what was going on with someone's body and their skin, i.e., of course, the cells that contain and grow hair, during the initial phase, right? So if you have been given this diagnosis and you know that what's staring you in the face, first of all, number one, you're stressed, right? Number two, you're scared. Number three, you're worried about how you're going to look during all of this. And then, oh my gosh, four is, what are you going to tell your children? What are you going to tell your family? Five is, if you're a male or a female, how is this going to affect your relationship? So we wanted to jump ahead and say, okay, all of those things are being really, really impactful on the body. We know, as trichologists in the world of hair loss, that stress causes hair loss automatically. Now, yes, acute alopecia due to medical-related treatment is different, but is it, right? Because hair loss is not fun. It's complex, it's complicated. And so what can we do for you, the medically induced hair loss individual that knows what's to come? Well, I can tell you, we can be proactive and we can start treating your scalp and we can start treating the hair. And yes, that means even if you're keeping 50% of your hair or 100% of your hair, let's be proactive and let's think about what the scalp needs, just as an esthetician would tell you to think about what your skin needs. So we want to think about stimulation early on. If we can start stimulating the scalp and stimulating the follicles well before maybe even treatment has begun, if we're fortunate enough to be able to get on the early and the front side of this treatment, let us help you. We can help you here locally, but don't let that stand in your way. We work with cancer patients all over the United States. We're able to help you by helping your stylist or by helping you with do-it-yourself in-home treatments. The first treatment is going to be talking about stimulation and detoxification. So let's get that scalp really nice and clean, right? Let's start stimulating the blood flow because we know that our hair growth in the hair bulb is stimulated by the cells in our body. So Yes, ultimately, if we're going to be having that chemotherapy or radiation therapy treatment and you have a special cocktail with your treatments that says, yes, you certainly are going to lose your hair, you're thinking, so why does it matter if I stimulate the cells? Well, it does, because the healthier the cells are in your body, even though the cancer drugs will kill off most of those cells, the cells are going to rebound faster and you are going to feel better in the process. So number one, let's get started ahead of time. Let's detoxify the scalp and let's stimulate the scalp. Step number two, as you start to feel that tingling in your scalp, and as your hairs actually start to hurt when you touch them, I always liken this to if you've ever had a really bad fever or if you've ever been really ill with the flu. We've had so many clients come into our clinic and say, oh my gosh, my hair hurts. How is that possible? Well, it is possible because your hair is also in a living, growing phase in part of its life cycle. So the hair that's in that life cycle, you better believe is going to hurt because it's still connected to your body. So we want to make sure, though, that as that hair exits and as you go through this aggressive shed with your chemotherapy treatments or with your radiation therapy treatments, that we are stimulating the cells and we're also stimulating the scalp with oils that are also going to be able to soothe and comfort that scalp. One of the things that happens is the dryness in our skin and our systems and our bodies. Many times if you're working with a naturopath or holistics, bioidenticals, and biologics, even in conjunction with your chemotherapy treatments and your traditional style of treatments, the one thing that we all talk about is hydration. Making sure that your body's staying fully hydrated. There is no difference in your body and your scalp. So we want to make sure that those natural oils and those stimulators are applied to the scalp. If the scalp is going through a tender phase when that hair is shedding out, or you're having a very tender phase and season of your life and you just need a little tender loving care in your scalp, we also have treatments for that and some nice soothing oils that will bring the irritation of the scalp down and also help the inflammation that sometimes builds and is around those follicles during this hair loss phase. Next, we move on to step number three. Step number three is the exciting part. The treatment's over, and now you just have to wait it out, right? 4, 6, 8 weeks, sometimes before you see hair starting to resurface on the top of the scalp, the eyebrows, the eyelashes, if you've been fortunate to lose it there as well. But now is when the time is to really start to stimulate the cells. Let's make sure that any form of stimulation that we're doing is deep tissue type stimulation. So think about going to get a deep tissue massage. If you treat yourself, and if you don't, start during your recovery phase of your acute hair loss and alopecia, go in and have just a scalp massage. Again, if you're local here within the Tennessee market, we're able to help you with these treatments. We love to see our clients once a week or even once a month, if that. And so we can treat you here. Again, we can also help you and train your in-home stylist or in your local area and trusted stylist. We can also help your friends and your family as well on making sure that they can help your scalp treatment at home. I'm going to stop here for a moment and let you know that most of the treatments that I've talked about in phase 1, 2, and 3, so before treatment, during treatment, and post-treatment for the regrowth phase, they're all listed on the HPI website shop. However, what I will tell you is that you will need some direction if you really want to dive in and be proactive across these phases. So first of all, feel free to purchase anything that you'd like on the shop. Secondly, if you have questions and you really want a care advisor to work with you and be your coach during this phase, don't hesitate to reach out to us. All of our information will be available after this episode. So now let's talk about the best part, the regrowth, but then truly re-stimulation. So how do we move the needle forward? How do we speed up the hair growth? How do we put it on steroids, right? I mean, you've gone through this miserable phase. Your new diagnosis is good. Your prognosis looks great. Everything is pointing in the right direction, but you still look in the mirror and you still have no hair, or you still have no eyelashes, or you still have no eyebrows. So that's where we get a little bit more aggressive. That's when we are big advocates and proponents of all forms of laser therapy. Now, in our clinic, we solely use a professional device. It's a laser cap device. There's no sales here. I'm just sharing with you what we use. There's another professional device that's on the market called a Capillus. There's lots and lots of retail items that are on the market over the counter. But what you really need to understand is you need to understand what's going on with the light penetration of the cold lights. So again, jump on our website, go to our e-store. You'll be able to see a good listing of all the laser caps that are available and the light penetration of how deep does that cold light really penetrate. We're also in a time and a phase, really, I guess it's been the last year, that there's been a lot more focus on red light therapy. So don't be confused. Red light therapy for treatment of bones and joints, red light therapy for our skin, red light therapy for healing for our gums. They're all great. And I will tell you that every study that we reviewed, every white paper, every clinical review, we've never seen anything but positive results. But make sure that you're using the right red light therapy for what you need. And in our particular situation, we need those deep penetrating laser diodes to help speed up and stimulate what's going on in that hair follicle. The next is, I want you to think about stimulation and growth when you're trying to regrow the hair as quickly as possible. I also want you to think about getting approval from your physician or your oncologist. It's really important that if you're going to be aggressive and you're going to start with, even though low-level laser therapy is natural, make sure that they approve this and make sure that they're bought in for you with this. The other types of treatments that we offer in the clinic is a transepidermal delivery system. There's no needles, there's no pain, and it actually breaks down kind of that outside layer of the scalp, and we're able to pulse actual growth factors that are moving into that scalp that are natural and mimicking a natural cell. And so we also offer a lot of those treatments as well. We shorten the name. Instead of transepidermal delivery, we call it a TED treatment. The treatments have been working really, really well for men and women. We use them for genetic hair loss, for chemotherapy, hair restoration, and hair stimulation all the time. So those are also some more aggressive treatments that you can perform. But just remember, the actual stimulation and the turnover of those cells is going to get that hair growing back sooner and faster and stronger and more natural than it ever will without just waiting it out. So proper cleansing of the scalp, stimulation, shampooing, making sure that you're getting hydrated, making sure that if you've been recommended to have IV therapies or stimulation to the body, that you move forward in a progressive way there. And at the end of the day, tell us what we can do for you. So our information is always below our podcasts and our YouTube videos. We want you to know that we're here for you. We're a team of clinical trichologists. We're able to answer your questions. We have video sessions that are complimentary. We also have long, in-depth video sessions to really dive into a trichological reasoning of what's going on with hair loss if it's not related to any form of medical-induced hair loss. So we're here for you. And more importantly, we want to keep you staying positive, and we want to be your coach through your cancer treatments and help you look the best you can. So as always, make it a great hair day and let us know how we can help. Bye-bye.